Hey everyone, OT Life Hacker here. Today, 4th day of occupational therapy fieldwork level 2 in acute care, and the day that I got fired as a student. The patient had a lot of wires and tubes and a lot of devices. They had the heart monitor, the blood pressure, the IV, the oxygen catheter, and a lot more attached to them. And the OT said, I was his apprentice. He told that to his patient, and his patient had said, your OT is fired. She does not. I was to be unhooking him from everything so that he can get up to go for a walk, and I was taking way too long, so he's like, she's fired. But he meant that as a joke. So yes guys, I am joking, but it is a serious thing. That it is so true. If you do not look confident or comfortable or just seem nervous or taking a while doing the wires and untangling wires and figuring out how to put the heart monitor box back into its place in the station, and figuring out where to plug in the IV and stuff like that, the patient will sense the uneasiness. I mean, will sense your uncertainty and be questioning, I don't know if I'm in good care, who does this person knew, how long have you been working here? You get questions like that because the patient will be wanting to figure out, am I safe? Am I going to be in good hands? And again, sure, the patient was joking, but there is a lot of truth to that. And so it was very important for me to, with the therapist, I had actually practiced. So at the end of today, we had gone into a few empty rooms. So no one was in that room, no patients were in that room, but all the equipment was there. The tables, the beds, the chairs, and the wires, IV box, the telemetry stuff, all of that. And so I got to manipulate all of that, work with all of that, practice figuring out what to do with the IV, that I need to unplug it when we're taking the patient out, to put it on the hook. So even though those are tiny things, when you're in the moment and when you're nervous, when it's your first time, when you're on your fieldwork first day, what have you, you may be kind of like, what am I supposed to do? What do I do with this? And so honestly, you could ask the OT, but you know, common sense is great too. And if I had the common sense over the nervousness, I'm sure I would have eventually gotten that, oh, I can hook the wire onto the IV hook so that it doesn't fall. I don't have to just hold it or what have you. And then we had, so the OT in the ICU, in the different rooms, in the different sections of the hospital, say for example in the ortho, spine, back unit, there's more of, you won't necessarily have as much of the telemetry stuff, the heart, oxygen, blood pressure. You may, but the focus is more on the hip precautions, the spinal precautions, and cervical, what have you, or sorry, no, yeah. And so you'll see that there's the hip chairs in the room, which is not called that, but the for hip precautions, patients may not be able to bend over 90, and so there will be chairs that are higher rising, and that you'll know to be the chairs for hip precautions or post-hip surgery. And then there's also chairs that are wider and lower, so that's not the orthopedics chair, but you'll see the wider chairs, and that's more for bariatrics, people who are on the bigger size, who need more space when they're sitting. And then for the wires, we had practice with the heart, blood pressure, and oxygen. And so I practiced pulling the heart monitor box in and out, which, you know, for many, I'm sure you guys would be like, that's super easy. But for me, I kept struggling because I was not placing the box back correctly, and so it would keep sticking out a little bit. And so I was practicing with that. And while you're doing that, you can't just be focused on the box. You have to also pretend, if you're practicing, you also have to be looking at the patient. So you have to position yourself so you're looking at the patient and putting the box in at the same time while still looking at the patient and making sure your box is in properly. And then making sure all the wires are attached. If you must, unattach the wires because they're all tangled up with the patient, or it's easier to do that, then you need to know how to plug them back in. And some of the wires are easy, others, there's like one had 3 prongs to it, and you had to position it at just the right position. And it was very nice because the OT had pulled out everything and then shuffled them all up, tangled them all up, and pulled everything apart. So all the wires, if they were connected to something, he pulled them all apart, and the blood pressure cuff, all of that apart, and then hid it under the pillow and said, have at it, plug everything back in correctly, prompto. And I was like, okay. So that pressure was actually really good for me, because when you put pressure on me, that's one of the ways that I kind of don't, while I feel like that's not the best way for me to learn, it sometimes is, because I know that I'm like, okay, this is dire, you're with the patient, have at it, do it right. And so it went fine, it went well. And then we also had done work with the beds, because the thing with the beds is that when you're doing the transfers or bed mobility, you can manipulate the bed, move it in any direction, angle that is appropriate for you, so that you have good body mechanics when you are helping the patient. If they are maximum assist, so you have to help them a lot physically to move out of bed, say they are a total hip replacement, or even had some sort of hip procedure and they're in a lot of pain, you have to help them. You may have to help them depending on how long post surgery, post procedure it has been. And then the bed, once you get them towards the edge of the bed, or even at the edge of the bed, then you can lower it to the height that their bed at home is, if they are going home, particularly, especially if the patient is going home, you're discharging them home, then you want the bed to be as similar as to the bed they have at home. So likely you won't have the bed at an angle, it will not be angled, or in chair mode, which is having the bed like this and then maybe more flat and then going back down for the legs. You'll have it flat, very likely. And then you also ask the patient, what level is your bed usually at home, and you adjust it to the level that their bed is at home. And couple of things I learned, so that also when you're adjusting the bed, remember that most beds have a lever on the bottom that can adjust the height to lower or raise, and so you can be safe in holding on to the patient and raising the bed or lowering the bed as you need, so that the bed is the height of their bed at home. And you also need to remember, first thing when you get in the room, unlock shut off the alarm, turn off the alarm. And then when you leave the room, before you leave the room, remember to put the alarm back on. That is very important, because the alarm will tell the staff that the patient is moving in bed or leaving the bed, however the alarm is set. If you do not turn off the alarm, ding, 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 the alarm will go off and you'll have everyone huddled around you. And I think, let's see, putting the bed in chair mode and lowering the bed so that it's head below the feet. That can be if there is low blood pressure, so you're trying to help get the blood flow to the rest of the body. And I think that is alright. That's everything that I want to share with you guys on how I got fired today, because not as confident as should be and comfortable and competent or what have you with the tubes, wires, the bed, the whole setup of the room. You have to be very comfortable with the setup of the room, because that's your playground. I mean, that's where you're going to work with the client and use during your session. So alright, I will talk to you guys later. I work again tomorrow, which is super exciting, to work on the weekend and see what it's like in the hospital on the weekend. Yahoo! Yay! Okay, talk to you guys later. I'm out. OT Life Hacker out.